shows, it's 50-50. Half use sterile, half use clean for fresh wounds, and there was no real big difference. If the person doing clean technique again this morning with their literature, and I limited them to 7 years, same thing, no difference. So,
It's a crapshoot.
it is a kind of a crapshoot, and the gloves that cost a couple dollars, that's their biggest impetus, it's too costly, but, again, you know, like faculty, I was talking to faculty about it this past week, and like they said, they need to know sterile technique, and most people use clean because it's quicker, but it's your choice, like it said in the articles. Right?
Well, I mean, like the article that we looked at, if you teach sterile technique,
You need to know
clean
it
is the
anyway.
same thing, only with clean instead of sterile.
Make sure your gloves are clean, that's the piece. Make sure that when they come out of that box, they're clean. You know, I have seen a lot of people, they fall on the floor, they put them back in. You just gotta really make sure. Before any procedure, you wanna wash your hands, right? Especially, this isn't sterile, but over there, right before sterile procedures, you wanna take the microbes off. Remember, any glove, even a sterile glove, could have holes in it. All right, so I'm gonna do a thoracic wound over here.
I'm gonna try and locate some blackboard later.
This afternoon? Yes. Oh, I did a sterile dressing last year, remember videos? So that's up there. Because, no, he's coming at 10-ish. Oh, yeah, so I got
Hey,
under that.
Come on, Steph. Is that a Montgomery?
And I've been uploading them all
No.
on the student Blackboard, all the videos I take
Oy vey. Okay,
on our
so
on the discussion board for YouTube, so.
this is a no touch. You don't have to do the sterile because it's already there, okay?
Okay.
So anytime you take off an old dressing, you're gonna put gloves on, right? And what I'm gonna teach you over there, you just take a little plastic bag out of the dirty or clean utility, and that's what we use to put our contaminated dressings in. Instead of putting them in an open environment. So again, what I'm gonna do is I'm gonna take off the old dressing, okay? Now with no touch, they were saying the biggest thing is to try to grab all the dressings at once, okay? This is a closed wound. It's still indicated for open wounds in the acute process, acute surgery, that we should use sterile gloves. That's what it says in your book too. But again, like some of the faculty were saying yesterday, NCLEX is behind on things when they test things. And probably we should continue with the sterile, but it is a controversy, okay? Take them off the way we showed you, put them inside of here. Remember, I've cuffed it so I can touch the clean underside and let it drop in. Then according to no touch, what you're going to do is you're going to open up, I wanted to use these up, so I'm taking space. You're gonna open up your saline. We have bigger bottles over there. And then what you're going to do is you're gonna open up the dressings that you need, okay? So the first one that I'm going to need, and it's without instrumentology, the first one that I'm gonna open up is my fluff. You're supposed to open up with no touch and using a sterile technique, all right? So what you're gonna do is you're gonna pull it back, and you wanna make sure that you don't let that touch the inside of that, because if it flaps back, it will contaminate that dressing, okay?
So I'm a little surprised that you don't wear gloves to open up
Nope,
the bandages.
clean on the outside, sterile on the inside.
Okay.
Again, you're gonna ease it open. Oh, that's a bad one. Okay, all right, I got it.
A little off topic, but not really. What is the likelihood that most, you know how you said 20% or 21% of gloves have holes in them or something? What?
In particular, clean is what I'm talking
But
about.
what is the likelihood that those?
They shouldn't have a hole in them, you should be able to see them because of the paper.
Okay.
Right, they call it package integrity.
Yeah,
Like you
thank
need to
you.
look over the package first, make sure there's no holes, make sure it's not discolored, make sure any of that stuff. It's one of the big things they teach us as a surgical tech. Before you open your stuff and put it on your sterile field, you look at the package integrity.
And you look to make sure, remember we talked about those blue central supply wraps, make sure the date is appropriate and not out of date, because it's not considered sterile otherwise. All right, so we're gonna open up the ABD, which it's plus or minus whether you use that in regards to a sterile technique. Now what I'm gonna do is I'm going to wet my gauzes to clean, okay? Don't reach over your field thus far. Okay,
The last one you called an ABD?
yeah, Curlex Fluff, 4x4, ABD,
Okay.
okay? So now I'm gonna inspect the wound. Can you describe it for me?
It's got symmetrical borders.
It's well approximated.
Yeah,
It's a little bit red, but is, hey,
but normal for,
yeah, normal.
How many days out?
A couple days. So it's well
Intact.
approximated. The other thing I didn't look at was the drainage in there, which was kind of serosanguinous, not a lot. And serosanguinous is a color that is what?
Pink.
Pinkish.
Pinkish. Good, very good. So now what they said to do is put on some clean gloves. You're gonna grab these little wipes. Okay. Now, in some of the two articles that Barbara and I found, okay, you wanna try to not touch the edge coming. Okay, you see how I did that with that one?
Right, basically one for one side and one for the other.
Yep.
I thought we didn't rub, we dabbed.
Yeah, thank you. So now what I'm gonna do,
Sorry.
I do clean like this. I don't clean over the incision, I clean from the side.
Okay.
If you're gonna go over and there's some crust, you wanna do a little
Okay.
dabby. Cause those
I didn't
crusts
mean
are
anything, I was
important.
asking.
No, it's okay. You're right, I did say that. Because you don't want to alter the integrity of that crust.
Or catch
right?
on the,
Yes.
and you don't wanna try and wipe the crust off.
Right, now what they're saying with no touch, don't touch the inside of these, kind of drop them this way. So it's, the cleaning part to me is the part that's not the best, but,
how would you
don't
wanna
dry
do
it.
it differently?
in one of the articles, they had swabs, which to clean, which is great.
Right, so you're not
Okay.
touching the end of it.
Correct.
And you didn't dry?
It
Air
would've
dry.
dried normal.
Yeah.
On a
It would've
people.
dried normal.
Okay.
Okay. Now, because I kind of touched the wound and what, normally I tell students keep their gloves on, but I did touch the wound when I was cleaning it. So I don't want to,
And it's all covered at this point, so I
Yes,
mean, it's
yeah.
not,
so what I'm gonna do is tape it, and the best thing to do when you're taping it is to put a little tab, right? So that you can easily pull it off.
Both sides or one side?
Well, I usually do both, just to be nice.
She likes this patient.
Yes. She
Or the
likes
next
all of them.
nurse?
Or the next
I was gonna
nurse.
say, it's more of the next nurse.
And then what I'm going to, does anybody have a pen on them? I'm not prepared this morning. Demerit.
Darn it.
Mine's over there.
Not a
Oh,
pen to
it's
be
over-
had.
Stop it!
They're all on the
We're
table.
all demerited.
Oh, you have one.
It's a pencil.
That's all right, it'll work.
Okay.
And you just put your name, date,
And
and
initials.
that's what I mean, initials and date.
Not directly on the wound.
And again, don't push down like this, right? You just wanna push over here, okay? Now, the other thing is if this patient gets up, sometimes if they have a lot of drainage, you gotta seal the bottom. Cause you don't want the drainage to go down.
I noticed that you